Welcome everybody to Cambridge Health Alliance Lunch and Learn. We're excited to talk about low back pain and what CHA has to offer for folks that have low back pain. And we are joined today by Dr. Christian Meisinger and Nico Beltrao and Ellie Vanderhoof. I think I have everybody, and we may be joined by a few other members of the team as well. So thank you all for joining us. So Ellie, I think you're going to take it away. So thank you all for joining us. This is an important subject. Oh, let me just ask if everyone mute, and questions can go into the chat. And just the questions, please, and the providers will ask any other, if they need any background information. And welcome to Saludos Vida, our Facebook Hispanic community. Okay, Ellie, take it away.
All right. Good afternoon, everyone. My name is Eleanor Vanderhoof, but I go by Ellie, and it's so exciting to be here with you all this afternoon to present this program that we have at CHA with you all. So this is the virtual back pain clinic that we created, or actually started the program back in January of this year, and it's been going well so far. So we wanted to share that with you all. Can everyone see my screen? I just want to make sure that
we can, Ellie.
Okay, all right. So the reason why we started this program is to solve this back pain issue that we all have experienced one way or the other. And approximately 7,000 of our patients have been seen in primary care annually with a chief complaint of back pain. And 50% of these patients are not seen over 5 days. So the goal of this program is to get patients seen as soon as we can. So we created a newsletter and also a back pain webpage for on our CHA website. And this newsletter basically gives you an information about what the program is about and how we can help you relieve your back pain as soon as we can. So the benefits of this clinic is for everyone to have access to a 30-minute virtual appointment with an orthopedic trained provider in as little as 2 days. So we want to get you in as fast as we can right when you call our clinic. And once you get into the clinic, you can receive a referral without going to the emergency room. We all know how that is. So we want to make sure we cut that out of your time. So you receive a referral to see a physician, a physical therapist, right after you see a provider in a couple of days after you make the appointment. And this is to help you get relief as soon as possible. So we also have a video that gives you an introduction of this program, which we're gonna play at the end of this presentation. So the services we offer is to treat acute back pain, sciatica, low back or lumbar pain, thoracic pain, and cervical back pain. We want to make sure that we address all the back pain issues that you have at CHA. So I just wanted to share a little information about our performance so far since we started the clinic back in January till now. So we have seen about 73% of our patients between January and May within 1 to 2 days, which is awesome because the wait time was longer than that pre-program. So there's been an increase in the number of patients we've seen so far, which is great. And also we have been able to refer patients to physical therapy faster than before. So I'm gonna share this video. I'll play this video for you guys to meet our providers that are running this program, which is awesome. And they can tell you a little more about this clinic, okay?
Hi, my name is Casey Gavin. I'm a physician assistant, and I'm one of the providers seeing patients in the virtual back pain clinic.
Hi, my name is Sluyter-Beltrao. I'm a PA working at Cambridge Health Alliance. I work both as a family medicine PA at Union Square Family Health and also as a physician assistant in the virtual back pain clinic.
The virtual back pain clinic was designed for CHA primary care patients to have the opportunity to start treatment for their acute back pain or sciatica as soon as possible.
The back pain clinic at CHA is a televisit clinic where we are able to see you over the phone or in a video visit, and that allows us to see you quicker.
Our goal in this clinic is to have patients evaluated by an orthopedic trained provider, ideally within 24 to 48 hours, to provide quick access for back pain relief at a lower cost than being seen in the emergency room.
The back pain clinic is great because it allows early access to physical therapy and early access to these medications, which improve patient outcomes. I treat back pain primarily that's in the low back or the lumbar region. I also can deal with thoracic back pain kind of in the middle of the back, and sometimes as well with cervical neck pain, which occurs higher up in the spine, closer to the neck. These types of back pain are the most common types and are reasonable to treat over a televisit, video, or phone call.
To get connected to the virtual back pain clinic, you can call or message your primary care provider's office for scheduling. We look forward to seeing you in clinic and getting you feeling better soon.
Thank you, Ellie. My name is Dr. Kirsten Meisinger, and I am one of the providers at the Union Square Family Health Center and also one of the team members that helped design faster care for you when you call with back pain. And so we are lucky today to have Nico here with us. You saw him in the video. He is one of the back pain providers that you'll see when you call for a same or next day appointment. I would just add that Nico is also fluent in Portuguese, and I actually am fluent in Spanish and Portuguese. So we do have a lot of multilingual providers for folks here at CHA. As you know, we do try to integrate that into our services with people who actually speak the language of our patients. And if independent of whether a provider speaks your language, we always have interpretation services. In fact, our interpreter services are award-winning. So please don't hesitate to call for a video visit or, as you know, an in-person visit, because we will always be able to speak to you in your language. Ellie did an absolutely spectacular job outlining our service. And I just want to pause and see, does anyone have any questions about how to access same or next day care for any of the back pain problems that you might have? All right, if you do, put it in the chat. It sounds like you did such an amazing job that it's perfectly clear, right? Call your primary care provider's office and we can get you the service anytime you want. Let me invite Nico now, because we're so fortunate to have him as part of our Lunch and Learn. Let's do some learning together. Why don't we talk about how to never have back pain? How do we avoid back pain, Nico? Because I don't know about anyone else, but I do not enjoy low back pain when I have had it in the past. So how do I avoid that? How do I never have low back pain?
Yeah, thanks for the intro, Kirsten. So, one of the most important things for avoiding back pain is actually safe lifting. A lot of people have back pain as a result of an acute event, bending over to lift something too heavy or some kind of trauma. And there's actually a principle of eight safe lifting practices, very easy to talk about, that you can do to prevent this from ever happening. The most important thing to know about lifting heavy things that are on the ground or below your back level is that you want to keep these objects as close to your body as you possibly can. So you want to have a broad, stable base with your legs. You want to bend your knees and keep your back straight throughout the entire process. You want to keep your arms close to your body and the object as close to the center of gravity, as close to you as possible. And then you want to move your feet only in the direction of the movement that you're actually doing. So safe lifting practices is huge. That's also something that is gone over by our physical therapy team when you go see them after seeing the provider in the back pain clinic. Another really important thing is stretching. Stretching exercises are huge, and these are things that you can do at home to maintain good mobility of the back. my personal favorite. There are many of them, and these are actually pretty accessible just if you Google them or look on YouTube and stuff like that. But cat-cow is a really good one. You kind of get on your hands and knees and kind of just move your back. You kind of tilt down and then tilt up and tilt down and tilt up, and just maintaining that mobility of the back is really good as well for preventing these injuries in the first place.
That's wonderful. I'm going to put in the chat something from the United States government, actually, right? The Office of Disease Prevention actually has some information about preventing back pain. So feel free to access that, everybody. If you have anything, Nico, or anyone else that you'd like to put in the chat as a resource to folks, that's great. We can certainly send it out later. So what is let's assume that I didn't follow the principle of 8, sadly. And here I am, I've bent over, I completely forgot, I shouldn't have bent over to go pick up something off the floor. And I stand up and I can really feel it. For me, it's always on my left side. So what do I do, Nico, when I have acute back pain? I have it, it just happened. What's the best way for me to take care of myself in that circumstance?
Yeah, absolutely. So the first thing that I would say about that is, reassuringly, many people who have these acute episodes of back pain will recover within a couple of weeks, and a very vast majority will recover within a month. So the first thing that I would do is reassure you. There are many things that you can do right in the moment to kind of help. And among those, very easy are cold and heat. So you can immediately put an ice pack on the back, or if you have a heating pad at home, you can apply that to the area. There are some medications as well that you can take with care that can help bring the inflammation down. Best prescribed by us, but in the moment you can try taking some ibuprofen at a low dose, or potentially Tylenol to help with your pain and bring the inflammation down in the region as well. And stretching in the moment is actually very good too. Kind of counterintuitively, some people are not familiar with this, but we actually want you to stay moving when you have these injuries rather than staying put. Movement is shown to be one of the best things that you can do. So if you can tolerate walking, if you can tolerate gentle stretching, then we encourage you to continue to do that until you can see us in clinic.
So I should only take medications I know are safe for me, right? So I've already talked to my primary care provider or you potentially, right, about whether I can take Tylenol or Motrin or ibuprofen. And then I don't want to go to bed with a heating pad, it turns out, right? I want to actually maybe put some heat on in the short term and then keep trying to move around. That sounds like what I should be doing, right?
Exactly. Yeah, that would definitely be the recommendation.
And what are things that are more concerning, right? Say I do that for the first day, and then all of a sudden I've discovered that I don't just have pain in my back. I actually now have some pain that's going down my leg. Is that something I should be concerned about?
Yeah, so pain going down the leg is more of a sciatica situation. Sciatica is this irritation of one of the nerves coming out of the spinal canal that can sometimes be injured in one of these typical, in an acute back injury like you're describing, or it can indicate that one of the discs in the spine is actually pinching one of the nerves. In that case, it's still not something that's particularly concerning, but if you were to have a lot more pain, if you were to feel weakness or numbness in the limb, then that's definitely something that you'd want to talk to us as soon as possible.
So it sounds like if my pain stays in my back and I can kind of handle it, I might not even need to call for a virtual back pain appointment, but I know I'm welcome to do that anytime. And it sounds like if something weird starts to happen, right, it starts to move to other parts of the body, that's definitely a time to reach out to my primary care office and maybe get on your schedule. That sounds great. Why is it safe for me to take your expertise in orthopedic training as opposed to waiting to come in to see my PCP? Why is that okay? Why is a virtual visit okay for something that is in my body and you can't examine me?
Yeah, that's a great question. So multiple studies have been done over the past 5 to 10 years showing that televisits for back pain are actually just as effective and show the equivalent or even better in some cases patient outcomes for people who have acute back pain. So we know that this is an effective way of treating people, even though we can't actually examine you in the clinic.
That's great. And so if for some reason I would need to be seen in person, say in orthopedics, are you able to get me there if I talk to you on a video call?
Absolutely. So that's the other part of the equation. You're coming in immediately to talk to us. And if we feel like you need to see somebody right away, we can place a referral for you to see somebody urgently and get you seen quickly.
That's
We're the
great.
first point of contact.
So it sounds like everything will happen more quickly if I go right through this virtual visit. What happens, Ellie, if I am really not great at video visits? How do I navigate that? What help is there at, say, the reception desk at my primary care office?
So our front desk staff actually will walk a patient through how to get into the video visits. So there's a step-by-step that we will share with the patient and walk you through. And sometimes if you're booking the appointment at the location or your primary care's location, we can help you with that on your phone, like right there and then. So we are here to help with every question that you might have on how to book the appointment or how to get into the video call. And if you're unable to get into the video call, we can also still, treat you over the phone. So whatever you're comfortable with, we're here to just assist you with that. I also wanted to share for some of us, I know not everyone is a CHA patient, but if you're really interested in, being seen at CHA, you can also call our Dr. Final department. We'll be able to help you book an appointment. And if you want to see a provider at the virtual back pain clinic, we can also help you with that. So.
Well, you have definitely covered all bases with questions and answers. I just wanted to let everyone know that the Dr. Finder number is 617-665-1305. Or you can always call the main number of Cambridge Health Alliance, which is 665-1000. Now, I have been a tremendous sufferer of back pain. And I know, so this whole idea of being seen video or even through, thank you, Lexi, telehealth via phone, because not everyone is on video. And I have some people that are resistant to getting on video. So this is an important piece, Ellie, thank you so much. But it also, when you are in and having an acute attack, of whether it's sciatica or disc issues or whatever, it's not always easy for you to move around. So I think the video, it's really good to know that the video health is, or telehealth via video is as effective, if not more effective, as getting in a car. I mean, when I had my last back attack, I couldn't lift my right leg. So I couldn't drive. I was, I Ubered. And I did it any way I could, but I was in excruciating pain with every bump I went over. So I'm really glad this is really beneficial to hear.
Yeah, interestingly, Roberta, sitting is one of the worst things that we can do for our backs. And for some reason, we love to sit in a chair. And that exact framework for your back is the absolute worst thing you can do. So one thing we can do when we have the back pain is stay standing and walk around, just like Nico said. And we can also try to do some lying or squatting or sitting, but the chair, interestingly, is genuinely something to avoid when you're having low back pain, because it's actually the worst position that we could put ourselves in, and we spend all day in it. So a simple way to also avoid back pain for everybody is to get up every hour at least, if not more often, and just do a quick little 2-minute walk, so that your body can get those nerves back in the right position they're supposed to be. That kind of back strain we have when we're sitting, especially if we cross our legs, is pretty bad. So that's another wonderful way for us to just try to prevent any kind of back pain. Don't sit for more than an hour ever. Try to get up and walk around and keep those muscles moving. That's another big thing that I think a lot of us discovered during the pandemic and having to be home so often is that back pain got more common because we were all in our houses and you can only stand for so long, right? We're all sitting more. We're back to normal now, pretty much, but just to mention that as well for those of us who spend a lot of time seated is ongoing.
Right, I think that's really important. And for those folks that may not have great mobility in the first place, you know, there might be some exercises or some things that they could do that might be a little more gentle. They might not be as flexible as on a good day as the rest of us. And I, you know, I'm on a good day, I'm pretty flexible, but I have my moments, as we all do. And the other thing I wanted to mention, back problems are not really just for older adults, right? People of any age can end up, young kids during athletics, or a whole host of reasons for people to end up with back discomfort.
So one thing I would just impress on people is when you have little children with back pain, we really do need to see those guys in the clinic, right? I also take care of children. Family medicine takes care of everybody of all ages. So when a little child has back pain, we do want to make sure there isn't something wrong. So this back pain clinic is really for adults. We want you to come an in-person visit for those little kiddos that might be complaining of back pain. It could be nothing, but it could be a little bit more serious because kids are amazing, right? They just bounce off of stuff and right, seem to be made of rubber. So, so if they have persistent back pain, please do make an appointment with us. A really wonderful way for us to keep in shape is just walking. We don't have to do a lot of fancy exercises. You don't have to join a gym and pay all that money and then never use it and feel guilty. You don't have to buy a fancy machine to have in your house, although exercise bikes in front of the TV are also a great way to stay in shape. You can just go out of your house and go for a little walk. It's wonderful for your trunk, which is the back muscles, to have you walk at least an hour a day. That keeps those muscles nice and strong, and it will also prevent you winding up with this acute back pain because one set of muscles has gotten weak because you're not using it all the time. It's use it or lose it at any age, but particularly after 60. That's where things really start to I think, spiral down in function, and we want everybody to live their best life and have all of the activities in your day that make you happy and never feel like you're not able to do those.
Thank you, Kristen. We have a comment in the chat here. The government website says to avoid bed rest when you have back pain, and you mentioned to avoid sitting, but it is tiring to stand or walk around for most of the time. So what are our alternatives, right? Treatments. What about alternative therapy treatments? Do they help us? Or I think we go on here.
Yeah, let's do the first question. Nico, what's your advice if you're tired of standing and walking around, it's been all day, and you don't want to sit in a chair because it's a bad position? What do you think? How can people be well in their house without sitting or standing?
Yeah, I think, you know, if you're limited in your ability to sit, then lying down is fine. It is certainly better to take that pressure off of the spine, like you're saying. Sitting is not necessarily a natural position for our spine to be in. So laying down is acceptable. If you're able to, while you're lying down, do some stretches as well intermittently and just keep that movement going, then that's so much the better. Many of these stretches, one good one is a knee to chest stretch that you can actually do lying down. Either in a bed or in a yoga mat if you have something like that available at home, or a soft carpet.
Nico, what about if you lie down, if you pick your knees up or fold your knees up, that takes immediate pressure off the back, doesn't it?
It does, yeah, and that's what the knee to chest stretch is actually doing. It's stretching those muscles out and taking a little bit of tension off of them. Yeah.
I do it every morning.
Well
What
done.
about,
Very good.
right, stretching is important. What if I've heard if you lie on your back and put your feet up on the wall, is it the same premise that it again takes the pressure off?
That is the same premise. And while you're doing that, you can actually do a rotational stretch where you turn to one side and then go, you know, take your legs and kind of go to one side and then go to the middle and then go to the other side. And that's another really great kind of trunk motion stretch that you can do in that position too. Yeah.
Yeah, these are all great to prevent or to remedy if we have like a little soreness. Sometimes if we have, if something hits us or we make a wrong move or lift up something, those 8 lifting guidelines, that's a lot to remember.
It's a lot to remember. Simplest way to remember it is bend your knees and keep the object close to you. Those are the most important ones.
I think we could do that one. Thank you.
So also in the chat, if everything is painful, if you are just so sad, nothing is going to make you better, then you need to call me. I am a primary care provider. You need to get on the phone and you need to let me know that you need some help. We are always here for you. We have a 24-hour on-call service at all of our primary care sites. Please do not suffer alone. It is absolutely fine to get guidance. And you can do that any time of the day or night. We will then be able to help you take medicine safely in your home. So you'll be able to get care overnight and potentially then get to the care you need the next day. Sadly, a lot of simple back pain, just like Nico said, hurts like the dickens and doesn't get better immediately. It takes a while. It takes more than a day or two. Oftentimes it takes a couple weeks. It can take as long as a month, right? It's just like Nico said, and that's okay. We just want you to get the guidance that you need from our teams to be able to be well. We'll get through it together.
One other comment I had, and you talked about either ice or heat when you have a back issue. I was always under the impression that it should be ice first, or maybe even alternate. Should it be one over the other, or is it, a lot of heat feels better. Let's face it. We like to snuggle up with heat. We don't like to snuggle up with an ice pack. So is there one over the other?
Yeah, that's a great question. I hear this in the clinic a lot. It's a very common question and a really good one. So ice is really good for bringing inflammation down. So what that's going to do is help with the pain a little bit and potentially help with, preventing it from getting worse and helping the injury to actually heal. The heat is going to be great, and it feels really good because it's relaxing the muscles in the area. So often you'll have these very tense muscles that are causing that pain that you're feeling. And so using heat actually relaxes them and lets them kind of loosen up a little bit, and then you feel better. So usually what I tell people is heat is really good, especially at night when you're trying to go to sleep. You want to snuggle up with that heating pad to get good rest at night. And then when you wake up in the morning, put an ice pack on. It doesn't feel great, but it's going to bring that inflammation down, bring the pain down a little bit, and let you be able to do the stretches and exercises that I advise people on, and that physical therapy will advise people on, to be able to actually heal the back.
Thank you. That's great. And it's so important because I don't think there's a person on the face of this earth that, at least an older person, that hasn't experienced some sort of back pain, right? So this has been really very informative and very inclusive. I just want to revisit, Kirsten, if people are part of CHA, they can just call you directly for the back clinic.
Yep. In fact, so one-stop shopping, whenever you need anything, please call your primary care provider office, whatever that office phone number is. We are excited to always help you. We are your guide across all of CHA. We will always be able to help you get where you need, and we can often make those appointments for you. So please always start with us. Also, if you start with specialty, they'll send you back to us to get a referral. So this is a no referral system. This is actually specialty within primary care. We're so lucky to have our orthopedic trained providers available to you same day, next day. Just call your primary care provider's office if you're a CHA patient. If you have a primary care provider, you probably won't have the same system, but you should always feel free to call them for any guidance that you need. And if you want to join us at CHA, you have the phone number for Dr. Finder. We would love to have you. There's a question just briefly, roll-on creams. Roll-on creams depends on the cream. Right, the active rolling can really relax the muscles. That would be lovely, but we would probably not recommend any cream in particular other than a prescription one, which I'm sure Nico can tell us about.
Yeah, absolutely. So there are a couple that you can do over the counter that people do find pretty helpful. One of them is icy hot. Icy hot's great because of that heating and cooling effect, right? You kind of get 2 for 1 there. Tiger balm is also really good. That's more of just the menthol, just the cooling. And then there's arnica, which is a homeopathic cream that some people find really helpful. And you can put those on as much as you like. Then there's some prescription creams, as Kirsten is saying, which you would then want to come see us in the clinic, one of which is an anti-inflammatory, kind of like ibuprofen that you apply topically. But those 3, icy hot, tiger balm, and arnica, are all great over-the-counter options.
I put those in the chat.
Yep, thank you, Kristen, for that. Well, thank you so much. I guess you've really covered everything that I can think of, and apparently there are no more questions in the chat so that anyone else can think of. So thank you so much for joining us, and thank you everyone. Hopefully this has been really helpful, and good luck at the back clinic. I'm sure you know, your cup will be overflowing over there. So thank you so much. And I just want to remind people that we do a lunch and learn on the first Wednesday of every month. And next month we'll be really showcasing pharmacy. And, you know, pharmacists do a lot more than just fill bottles. So stay tuned for that one on the first Wednesday. I believe it's August 3rd.
We
So
love our
again.
pharmacists, Roberta. I second that. We love our pharmacy colleagues.
Thank you.
One more chat. There's
Oh.
one more in the chat.
I got that one.
Oh,
Yeah.
okay.
Nope. It's still a sitting position, guys. Not ideal. We're going to have to move away from sitting. It looks like we're going to have to learn from cultures that do less sitting. I'm excited to learn.
Okay, thank you, everyone. We'll see you next month. Thank you again, Nico, Ellie, and Kristen. Take
Thank
good
you,
care.
everyone.
Bye-bye.
Have a good one.